So I may be the luckiest orthopedic surgeon on the planet. I have a great team here. So we've been able to identify people who have a passion for pediatric orthopedics, identify people who have the same heart, the same ability to kind of take care of the patient without regard for their status, for their ability to pay, and just focus on what's right for that kid and that family. And I think every one of my partners is somebody I would let my own children go and see. So I take care of the full gamut of pediatric orthopedics, but really kind of subspecialize in spinal deformity and cerebral palsy. So, but luckily here we take care of a rather large area and see children from 5 or 6 different states. So it's a wonderful practice to be in. It's really an opportunity. We get a chance to take care of the child from the earliest onset of problems and then help them through that, and more than that, help the families. So a lot of these issues that children have are really significant, and they affect not just the child but the entire family. So anything we can do to help that child helps that family as well. Getting to know the patients is kind of fun. So as some may know, I'm from a big family. I'm one of 10 children, and certainly have children of my own. So there's a certain childhood, aspect to my personality. So, you get down at their level, you kind of look them in the eye, you engage them in things they're interested in. And it's kind of fun, And so part of that, doctoring is really getting the most out of your patients. And so by really, listening to them, and they pick up on that. So don't just focus on the parent, focus on the child. And it really works. So actually, after going to medical school, I was thinking of being a pediatrician. And that's because I grew up in a large family and grew up overseas, and really thought the plight of children was something I could add or at least take care of. So while in medical school, it was a growing experience. My first rotation was actually on pediatric oncology, and it really hit me hard. It was hard to see children like that. And I kind of, for a while there, bailed out and thinking of becoming an orthopedic surgeon, thinking that was easy. You fix things and they get better. But after growing up a little bit, I kind of went back to pediatrics and became a pediatric orthopedist, because we do deal with really difficult problems, but we can help kids significantly with what we do. So at UK, it's a trauma hospital. We see quite a bit of kids with little broken bones. We also see infections and some of the more significant orthopedic conditions. Whereas at Shriners, it's primarily an elective practice. So what that means is we have kids coming in with non-acute issues, things like scoliosis, club feet, bow legs, knock knees. And so the two practices are very, very different.